What's the big? Oh,
It's a,
facting.
Puerto Rico has a new bill that they're discussing soon that that will potentially fine parents for having obese children.
Yeah, just read about it.
Okay.
Basically, I think the system in place is that the schools, the teachers would look at maybe potentially endangered kids whose health are endangered by obesity, and they would recommend them for the program. Like they would raise that this kid is
Potentially obese.
potentially obese. So there would be a checking of the health,
medical exam.
medical examination to determine whether or not it's a dietary problem or it's genetics. And if it is, they would give a warning, issue an official warning, and then the follow-up will be in 6 months. And then in 6 months, they will determine if there's been any improvement, and only 6 months to a year after that will the fine be levied from $500 to $800. What I read, and so there's a lot of time after the warning, after the second assessment. They would give maybe 6 months to a year to see if there's any improvement, and if there's no improvement, that's when they issue the fine.
I think from the first assessment, they will try to determine whether it's a genetic thing,
Yeah,
whether it's a health condition, a pre-existing health condition,
Right.
or whether it's eating habits or not enough exercise. If it's something that can be changed by the parents, then the child and the parents will be given 6 months, and if it's still there, like you said,
right.
is it 800 or 500 to 800?
500 to 800 is what I read.
$500 to $800. So they're going to discuss it, and we're going to discuss it now. What do you think about that proposed bill?
Well, like I like the intention, like to make sure that the kids are healthy, diba? And I like how first there's an examination, and they're given a warning, and that they have time to like fix the problem before an actual fine is.
Is it 6 months to a year, or is it just 6 months?
My understanding is 6 months after the warning,
Yeah.
there will be a follow-up.
Okay.
And then that follow-up will determine if
Improvement.
yeah, but that's not the moment. That's not the deciding factor whether or not they'll be fined. They'll be given 6 months to a year after that. So my understanding of
Yeah.
it.
Okay.
And then they
So probably depending on the gravity, the weight.
Oh,
Yeah,
probably.
Yeah.
And
Okay.
I think it's a step in the right direction. I'm not sure about, well, fining. Sure, it could be like what's this negative. It makes them okay. Oh, I won't need to fix this because I don't want to pay up.
Yeah.
But like, I'm not sure if fining them if they fail to comply would actually accomplish much, because like in many cases, the people who already have a hard time finding good diets and
Affording good diets.
affording good diets and finding the time to exercise are the families that are already impoverished.
Yeah.
And if you're going to like fine them even more, that might exacerbate the situation.
Yeah, you mentioned about how it's the poorer families who have a harder problem with helping their kids or themselves even with their diets. Of course, the angle of fat shaming would come into play here. Would that make the problem of fat shaming, which is already a problem in many countries? I assume in Puerto Rico it's also a problem. Would it increase that, do you think? Because there's a study, I think I saw it on IO9, that there's a study that showed that fat shaming doesn't work, and it even tends to worsen the problem. But the fat shaming here is not specifically for kids. I think it was adults or a range of people that they studied. So it's a quite different experience here because this is for kids.
Yeah.
And the assumption here is that kids are not so independent when they
With their
get
choices,
fat.
yeah.
It's a big part of that is the responsibility of the parent. What do you think?
Well, I think like people just have to be very like, I don't think it's so much shaming as it is like just pointing out that, okay, this
Observing,
might, it's an observation of something that could be problematic.
Yeah.
It's not so much an assignment of blame, especially for like the children,
Yeah.
because it's not the children who are being fined. It's the parents who are like given the responsibility of taking care of their children's diets. So like, it's not. I don't think it's shaming. It's not, I don't think it's the same as shaming.
So do you think like there's a potential for kids who are in the program, like I don't think the teachers will flag them so publicly.
Yeah,
like,
exactly.
You
go to the clinic.
Yeah.
You look fat. You don't do that to the children.
Yeah, Mr. Manuel, please report to the principal's office. It's not related to your grades. It's not related to anything bad you did. It's something about your body.
God,
wink, wink. Yeah, they won't do it like that.
Wink.
Okay.
Yeah, but I agree with Pepe. Like the fine isn't very at the point. Let's say it takes 1.5 years before they decide. Okay, there's no improvement. We're gonna fine the parents. At that point, the fine isn't gonna help the kid.
Yeah.
Like it's just punishment, and it's not helping in the process. Like the threat of the fine is more effective than the fine itself. But when you get to that point, and then you're finding someone who either can't afford more healthy food or can't find the time. The parents can't find the time to watch their kid 24/7, or the food available in the house isn't really the healthiest food, and these families are now faced with $800 fine, and imagine the environment that kid's gonna grow up with, like being the pressure being put on him or her to lose that weight, or he's gonna cost their parents $800. So while it might not be, I think the government taking a stand against obesity isn't necessarily fat shaming. It's basically, this is more healthy than that. It's you could apply the same thing to if your kids were smoking and then you want to stop them from smoking, right?
Okay.
So if your kids don't stop smoking after 6 months, then they're gonna fine you. So it's really not the kid's fault, but the pressure will be on a lot of kids. Might not be all of them. Maybe I imagine a lot of parents will be able to help their kids, but those who don't, those who aren't even able to, the kids will feel the responsibility. They'll know about this. They know it'll be their fault, and it might actually end up harming them. So I don't know how effective the actual fine program might be. Maybe more supportive laws in place, like we will help you do this. But the fine, I'm not so sure about that.
That was what I was going to mention. Like I'm assuming that there will be medical experts who would give advice to the parents on what kinds of programs would work best for their kids. They're not gonna, whatever happens, just we'll leave you alone and check back on you. I think they're gonna try to get these parents on a sort of program. And what you mentioned about the analogy of not smoking is, I think, an apt one, because obesity is related to a lot of other diseases, heart attack, high blood pressure, that could be, and it exacerbates pre-existing conditions or makes, genetic conditions that are not healthy manifest more if the child weren't obese. I think Tim Cook, Apple, was it?
Yeah, what about him?
I think he called sitting the new cancer, something like it was an exaggeration, but he was using that to advertise the new iWatch. So he's saying that device would make kids more likely, or people in general, more likely to get off of their butts and not be obese and not be unhealthy. So let's try to assume here that let's try to go through the one situation, right? A kid is flagged as a potentially obese person, and it's done in private. The parents are contacted. At the very least, there's already benefit from this.
Yeah.
Because I assume that the kids would be, and the parents would be educated about the risks of obesity, and the things that could be done. Like I said, there could be a program or a diet plan that could be followed in 6 months to 1 year. So that's already the benefit. And it would spare the kid from perpetuating those bad habits that he would carry for the rest of his life, probably, if no intervention was done. So that's certainly a good and a benefit of this program. and then they go through the 6 months. They will try, but if they fail, yeah, that's an issue, especially for poorer families. Which is why, another possibility here is for there to be tax rebates. I think so. Make it a reward kind of thing for if they do manage to accomplish the goals, then they would get a tax rebate
instead.
Which because it saves the government money in the long run, which is why they're looking at this. Because if they have that healthcare system where they would pay for their citizens when they get to the hospital for those diseases that are related to obesity, I think this intervention could be cheaper.
Save money in the long
run. Yeah.
I imagine like the worst way to go about it is you actually just tell them like, hey, your kid is obese.
They have to weigh this much in 6 months.
He has to not be obese by this time.
So it's like a boxing weigh-in.
Now get out.
They're just gonna cram like 2 days before, like water, like
and then
rehydrate.
And they don't tell the parents anything. So that's like the worst possible way.
That's the worst possible way, and it just reminds me, if you leave people alone, in today's modern societies, they tend to become fatter, and a lot of that I think is because of advertising. So much advertising for unhealthy food. Coca-Cola becomes the new water. When people are thirsty, they think of drinking Coke or sugary, high fructose beverage. They eat candy. I don't know. Whatever.
Fill their heads with candy.
Super stimulus. Sugars and salts,
chocolate
and chips and all of these delicious things are all over advertising.
Yeah.
And especially McDonald's. And Jollibee and stuff like fast food. Again, these are cheaper because they've been factory. There's a factory system that goes into them. That's why they're cheaper and more accessible and more people, and they're delicious because they just use the sugar and fat.
Yeah, I'm thinking now that you mentioned all those factors for why kids will most likely become fat if left alone.
Yeah,
it's kind of unfair. I think this law, it puts a lot of weight on the parents to feed their kids more healthily when the options are not really there. They're not easy to come by. If they were, I think, if they were easy to come by, there wouldn't be a large disproportion between poor people being able to get very unhealthy food versus rich people getting more availability to healthier food. So I think this law threatens the parent. This bill, threatens parents with a fine and does not give them more weapons to work with, more tools to work with, healthy food, and they're fighting against advertising. They're fighting against product placement in movies. Product placement really works. I mean, it's ridiculous how much it works. And So look at the food available to kids. The food served in their lunch in school is like soft drinks everywhere. There's lots of sweets. Their bread is frosted with so many things, and this is what the parents have to fight against, or else they'll face an $800 fine. So I think if there are more resources, first give the parents more weapons to fight with. Fight against the advertisers, for example, or
tax the advertisers.
Tax the advertisers. Like there's an unhealthy tax, for example. Then you could use the money to fund
sugar tax.
Sugar tax, and fund the support systems that will help the parents. And now, if it's now believable that an average citizen can afford healthy food, and they've just not been doing that for their kids, then you can tell the parents, like, you have no excuse. There are available, affordable foods that are more healthy, and then you could threaten them with a fine, maybe.
Remember that movie, that documentary that we saw, discussing just this?
I think so. It was
about the food pyramid.
Yeah, about sugar.
What's it called? Food?
I remember. I think it was Katie Couric was.
It'll be posted here magically. We don't remember the title right now, but it shows that the culprit, isn't so much fat as it is sugar.
Yes, right.
And the way that people intake, like the way that sugar is processed, it makes it hard for you to exercise like the sugar that you take in, such that it's sort of impossible already for kids, more so, to exercise the way that they gain from the food that they eat. You know, unless they eat like food with high fiber, which is not usually the case. So again, like you said, it's an uphill battle for these kids, for these parents. But it's a well-intentioned bill.
Yeah.
And it does attempt at least to start addressing the problem of obesity, because it's very touchy. You know, if you try to pass on the taxes to the cheap food, then a lot of families won't even have food to eat. Period. You know, forget about healthy food.
Yeah.
They wouldn't even have food to eat, because you know they tend to rely on these things. So it's really very hard, especially when you're a poor family.
Poor family.
Poor family, you can't overstate how hard it is. And you know, the government should, instead of fining people, maybe try to just reinforce them. It's hard to do it on the national education level because, well, they could supplement.
Yeah.
I changed your mind. You could supplement education, because I'm just thinking that what if you teach kids that it's bad to be fat, right? And then that would increase the fat shaming, unless you have something in education that also counters the fat shaming at the source. You know, to teach kids through stories or examples about why fat shaming is bad.
Yeah.
Okay.
Something related, like I think, hopefully, you're both familiar with Soylent, right? If you're not familiar with Soylent, this is Soylent.
The green or the regular?
It's based on that anyway.
Like the Soylent food substitute. Like I'm hoping that if we get enough research into it and it gets improved such that it's a good healthy food substitute. Like every day you just take Soylent. Then this could be, and if it's cheap enough to produce, this could be the backbone for something like a national food service. Like, okay, if people are poor and they just need food,
there's an option at least.
There's an option of like government subsidized Soylent, or just maybe even free if your country is relatively like
economically healthy.
Yeah,
developing.
No.
Well developed.
Not really. They can't really afford a national feeding program of Soylent if they're still developing. But you know, enough to have social services like this in place.
Okay.
Just something off the top of my head. Just it's something that would secure the hunger situation in your country. Like you can be sure that no one goes hungry, because if they can't find something to eat, they just go to the local food service, get some Soylent, and also it's not like sugary or too fatty.
I think if that was in place, that would be nice. I mean, then like you could really put that sugar tax in place. Like they're not gonna starve. You know, your people are not gonna starve and then they'll be forced to make healthy food. They'll compete against Soylent, which is relatively tasteless, I imagine, in its bare form, but healthy.
Okay. You mentioned the government even supplying that, and a lot of people would be against any sort of government intervention. Like, is this too much government meddling? You know, like if citizens want their kids to be fat, because I had a fun time growing up as a fat kid. I'm fat now.
Jolly, like fat kids are always jolly.
You know, I'm obese now, and I have no problem with it. Like, are you saying that my lifestyle is wrong? You know, there are people who will argue this way.
Yeah.
And, you know, human rights people, and they would not completely be baseless with their arguments. I mean the question is this a form of child abuse now? Like, is it neglect when you allow your kids, or when you put your kids in an environment that's not totally in your control anyway, that lets them grow into obese children? Is this neglect? Is this abuse on the part of the parents, and why are they being punished for it?
If you're gonna ask me, like, it's not abuse, maybe neglect. It's not so clear cut, because, like, as you said, there's the economic conditions everywhere.
I think if if they're making that argument, then they're arguing also that it's a matter of choice. Like it's not. They're not saying like I didn't have a. I know it was wrong. I just didn't have a choice. It's a different argument from well, I had a happy childhood, so I don't mind them being fat. And that makes that then they're admitting that it was their choice. Like they're gonna leave them to be that fat. But and I would argue it is neglect. If there will be people who will agree that it's not unhealthy to be obese. Science will counter that with health records and statistics. So it is unhealthy
Just
to be obese.
look at the measles situation, and you know how.
Yeah. So there. It is unhealthy to be obese, and your child is not an adult. Well, until they're an adult, but
Yeah.
at the child level, right? They're not choosing. They don't know the consequences. They're not as educated. So the future they have down the line, they're not thinking about that too much. And you might have your own opinions about how your life went, but their life is not your life, and you're putting them at risk, even though you might not agree with it.
Yeah.
You're putting them at risk for lots of diseases that are waiting for them. And when they hit 18 or whatever age that they're on their own, like they have the cards that you dealt them, and they might not want to have been obese. Like they might not have known they had a choice.
Ultimately, though, I want to adopt the policies. Not
Okay.
I wanna adopt
That
policies
escalated
in the
quickly.
spirit of you know the book Nudge, right?
Yeah.
It talks about suggesting like good suggestions.
No.
But with
making
freedom.
the default
making
Good
good
for-
defaults. Yes,
yeah.
making good defaults.
good for citizens.
and making it easier to make better choices.
So yeah.
So you would
recommended
still be free.
items.
You would
Yeah.
still be free ultimately to grow as fat as you want.
Yeah.
I would argue that's a fundamental human freedom. That's your body.
Yeah.
At least when you become an adult, diba? But we will just make it a lot easier to be healthy, and in this case, healthy also means not being obese.
Yeah, having thought about this for a bit, I'm more inclined to go that route. Like, for example, having a mandatory class or that teaches you how to avoid obesity. Like, make that part of physical education because, just exercise isn't enough. So give your kids this much mandatory education. Give parents that much mandatory education as well. One kind of intervention is give free food that's healthy.
Yeah.
By default, they can choose other food, but by default, just make it the healthy one.
Yeah. Sure, they would discuss this in PE class, like, food pyramid. It's not even
wrong
scientifically.
They updated it now. They updated it now.
But like they would discuss it, and then they never really made sure that we use it in daily life.
They'd be poking their noses in our own.
Pero nudge lang. Like, you can change it around, but the default is na.
Yeah, but like maybe even just a journal. A journal that is not really graded according to what
that's
you
actually nice.
It helps you monitor yourself. You just write down what did you eat, and then what do you think about your choices.
That's the.
And you're not gonna grade. This kid is eating too much sugar. F. You don't do that, but at least it helps them reflect and compare to what the ideal is.
Even if the only thing that you track is your weight, it's been shown to be a significant enough change such that people who just monitor their weight will either maintain that or improve on that. So the addition of monitoring or journaling what you eat, also with some context, because if they didn't know which was healthy or which was not, that would be good enough. So I'm changing my mind about the Puerto Rico bill. Not so good. Thanks for watching this episode. Like, share, comment, subscribe. Happy Valentine's Day. See you at the next meetup, and see you next week.
Bye-bye.
Bye-bye.